We're on the far south coast of New South Wales, which is the southernmost part of the COORDINARE catchment, our PHN. We have a practice that includes about 3,500 patients. Beg is a relatively poor town with quite a large proportion of lower socio-economic status patients, and up to 10 or 15% of our patients can't read. If you don't measure what you do, you've got no idea really about how effective your healthcare delivery is. And so we set about then starting to clean up our data, and that has given us tools to use for improving our delivery of care to our patient cohort. Well, it gives us a very accurate snapshot of where our individual patients are in terms of their health journey. So the data auditing really clarifies for us the areas that we need to target our efforts, and so that kind of global picture is critical to delivering a health service. I think it started about 2 years ago. We're quite early adopters.
Being part of the data quality program has even improved and advanced what we do a lot more now. We can go through stage by stage, looking individually from diabetes to COPD to where we're missing important data.
So we run current reports to get the data, and then we use the data to compare against previous reports and also against our peers within the region.
We have recently looked at the number of patients who are on mental health medications or antipsychotics or antidepressants, and we've realised that 75% of them actually don't have a current weight or BMI recorded in their notes, and that's absolutely critical.
It starts right from the patient walks into the front desk, where front staff are involved in the demographics, to have as clean a data as we can get. We can check if they've got a high HbA1c, if their cholesterol's high, if their blood pressure's high.
It's an aggregated result that allows us to compare ourselves to all of the SENTINEL practices, and it is really good because it looks at the basic demographic questions that we should really be answering. It's about delivery of care. So it's a very valuable tool. Well, we use it in a number of ways. We use it to help benchmark us in terms of our colleagues and our local area.
Our health coordination consultant shares the data with us, and we use this to benchmark how our practice is going and also the areas that we can improve within our practice.
Secondly, we use it to improve patient clinical care. We established a long time ago that unless we measure what we do, we really don't have any insight into how effective we're delivering our care. It is overwhelming when you start, but you need to start one step at a time in a manageable fashion, and you also need to work as a team, so you need to get everyone on board. So it has been really good for developing how the practice works and encouraging people to work together to improve the outcomes for our patient cohort.